Good afternoon, everyone. For those of you who are joining us for the first time, I'm Judy Irwin, the Senior Manager of Communications at the Ontario Long-Term Care Association. Welcome to our weekly KnowledgeBREAK webinar series. We're going to be continuing these webinars for you in 4 more in this 2021 series, and we'll have a full new range of programming for you in the new year as well, so please stay tuned for that. To kick off our webinar this afternoon, I'd like to start by acknowledging our KnowledgeBREAK sponsor, the Center for Aging and Brain Health Innovation. I'd like to thank them for their ongoing partnership and work with OLTCA. And with that, I'm delighted to introduce you to today's speakers. And we have 5 people with us today, and I'll walk you through their names and their titles. First, we have Lisa Francis, who's a knowledge broker with the Ontario CLRI. Matthew Goldborn, the knowledge broker with the CLRI. Jenna Pir Mohammed, a knowledge broker with the Center for Aging and Brain Health Innovation, also known as CABI. Raquel Meyer, who's a manager with the CLRI. And Shushmita Rashid, who's Senior Manager of Knowledge Mobilization with CABI. Today's discussion, we're going to be talking about LIPHA, which stands for the Learning Interprofessionally Healthcare Accelerator. And it is a very valuable new free training program designed by long-term care for long-term care. And it's a virtual practice accelerator. And it is to support you in your new hire orientation and training in your homes. And today's webinar, the team's going to take you through how it works and how it can make a significant difference to onboarding your staff and helping to support your teams. And with that, I'd like to pass it over to Shushmita to start today's session.
Thank you so much, Judy, for that warm introduction, and thank you to the OLTCA team for having us today. And we're very excited to share with you information about LIPHA. Next slide, please. I wanted to start off by sharing that LIPHA is an immersive learning experience that happens with Queen Dido in ancient Carthage, and you'll hear all about Queen Dido in ancient Carthage in the next few slides as we talk about LIPHA, but just wanted to welcome you in to hear about what LIPHA can do for you. Thank you for that. And again, if you think about LIPHA, it's a virtual practice accelerator that enhances new hire orientation and training in Ontario long-term care homes. And we'd really like to take the time today to share what LIPHA is all about, but also hear from you around how you think LIPHA might support your training and orientation activities as well. Next slide, please. That's just the team that's here with us today. So everybody's already been introduced, but I did want to highlight that we work in collaboration with a number of partners on this project, including Ontario Centers for Learning, Research and Innovation in Long-Term Care, Baycrest, the Center for Aging and Brain Health Innovation, as well as Launch 57, among other partners as well. Next slide, please. So our learning objectives for today, as I mentioned, is to learn about LIPHA, a joint project that's between the Center for Aging and Brain Health Innovation, or CABI, and the Ontario Centers for Learning, Research and Innovation in Long-Term Care, or CLRI. Discover how serious educational games can accelerate training and orientation for staff working in long-term care. So we will take a few moments to describe how serious educational games can help with training and really the why behind the way LIPHA has been designed and developed. So really happy to share that with you as well. We also want to share by the end of this session, increase your understanding of the features and benefits of LIPHA and how it might be integrated within your existing training initiatives as well. And then also explore support options that are available for introducing LIPHA into your existing programs. So one thing that we want to highlight that LIPHA is free for Ontario long-term care homes. So anyone who is on the call who qualifies as such, we are very happy to offer this to you and talk about what that could look like. Next slide, please. Just wanted to get a sense of who's in the room and who's in the audience or this virtual room as it may. If you could just take a moment to introduce yourself in the chat and share your favorite game. And the reason why we say your game, it could be any game that you either use on your mobile app or on your phone, on your desktop, any game that you play with, feel free to share that in the chat, as we would like to kind of get a sense of what that could look like. In terms of myself, I also like Angry Birds. So just as an FYI, since I'm not participating in the chat, but I'm seeing a lot of coming in, Settlers of Catan, quite a few different examples of of games that people are playing. Wonderful. Excellent. From the responses, I'm seeing that there's the classics like Monopoly, Scrabble, all the ones that people really, you know, those childhood classics, and some cool ones that I'm not familiar with, and I definitely want to check out these games as well. So thank you so much for sharing, and it sounds like we have quite a few gamers in today's session, so that's great to hear. Thanks so much, everyone, for sharing that. So I'll just go into the next slide, please. So I wanted to give, yes.
I know there's a poll to launch right here that you wanted to launch for an introduction. So I'm going to launch this poll for you.
Yes, and that was also part, thank you, Donnie. I'm sorry I missed that. We did want to get a sense of your role in terms of, you know, if you're an educator, administrator, manager of care, director of care, any other role that you might have, feel free to write that in the chat as well.
And this is a two-part poll. So if you scroll down, you won't miss the second question if you scroll down on the poll.
Perfect. And as Donnie mentioned, the second question is about how much do you know about today's topic, which is the LIPHA training platform we will be describing.
And we'll give it about 30 more seconds. I see some more responses coming in. Okay, I'm going to end the poll now and we can see your results.
Great. It's wonderful to see that we have quite a mixed group here in terms of people representing different areas of long-term care, education, clinical care as well. That's wonderful to see. And then in terms of how much do you know about the topic today, the majority is not a lot. Well, we're glad that you came to today's session, so you get to learn more. So we hope that you get to find some information. And it sounds like some of you are already familiar with LIPHA, so that's fantastic. And we thank you for your continued engagement and interest as well. So I'm just going to dive right into introducing kind of where LIPHA, before we dive into LIPHA itself, kind of the organizations that brought together and got together to bring LIPHA to you in this way. And it's about the Center for Aging and Brain Health Innovation, as well as the CLRI, who are also represented with our teams here today. Just the next slide, I'll give you a brief overview about CABI, because I know many of you might already be familiar with CABI, so just wanted to just make sure everybody gets a sense of where we're coming from. CABI is a solution accelerator. Our goal is to find the most promising products, programs, and services that are out there and help them get into the hands of those who need them the most. So our work is really involved in terms of identifying those programs and services and helping them get validated, getting them spread and scaled so they can get into care organizations, community-based organizations, as well as in the hands of older adults and caregivers as well. Next slide, please. One of the things we want to highlight that CABI works with this community of innovation, which includes older adults and care partners. It includes the innovators who are designing solutions, but it also includes care delivery organizations such as many of the OLTCA members who are present here today. And we work with partners as well as OLTCA as a strategic partner to really move through what we call the innovation pipeline so that we can find the best solutions that are out there, We can help get them designed and developed with the input from this community of innovation. And we can move it through this pipeline so it gets validated and refined to show the outcomes. So in terms of many of our solutions improve quality of life and quality of care outcomes in long-term care settings, for example. And once we know that these solutions are showing the outcomes that we want to show and achieve, we want to get them, we don't want to keep it a secret. We want to get them spread and scaled across as many sites and organizations as possible. So that is really our goal at CABI. And we're very delighted because the LIPHA project is basically an example of an innovation that really focuses on improving training for long-term care settings. And CABI's role is really to support its implementation and scale. So that's something how kind of LIPHA fits in with what CABI does as a solution accelerator. And in terms of the next slide, if you are interested as an organization to kind of hear about what other innovative solutions are out there, feel free to join CABI's Innovation Network. The website and web link is right there, just to get a sense of what are some products, programs, and services that might be of interest to you and your organization. And we'd be happy to connect to talk about, what would it take to bring some of those innovations into your own setting. And we'd be happy to share that as well through our Innovation Network initiative. I'll pass it on now to Dr. Raquel Meyer from the CLRI to share a little bit of information about CLRI as well as LIPHA. So Raquel, over to you.
Great, thank you, Shujmita. Next slide, please. Hello, everyone. Hopefully you're familiar by now with the Ontario Centres for Learning, Research and Innovation in Long-Term Care. We've been here since 2012, and we focus on education, research and innovation, and knowledge dissemination. So LIPHA is one of our products in the education bucket that we are sharing today. Next slide. So within the current context that we find ourselves in as a sector, we've been thinking really hard about how we can overcome the challenge of in-person training and student clinical placements. And how do we help people prepare to succeed and integrate themselves into a long-term care home, whether they are a new team member or whether they are a student. And we had this prototype, and we wanted to move forward with it because it really enables virtual learning experiences. And so let's introduce to you LIPHA, our virtual practice accelerator. Next slide. It really has been designed for long-term care by long-term care. It is essentially software. It is grounded in simulation and case-based or problem-based learning. That means real-world scenarios, real kind of clinical situations that team members and students would face. And we've wrapped it in a serious educational game. And essentially it constitutes what we would call digital open world learning. And so without further ado, we're actually just going to show it to you because I think it's just so much more interesting to see it. So we have a short video. Please go ahead.
Are you looking for new ways to onboard team members more quickly and more effectively? Accelerate your training and orientation process with a powerful virtual training solution to improve the proficiency of new personal support worker and nursing hires in your long-term care home. Introducing the Learning Interprofessionally Healthcare Accelerator, an innovative, interactive, and effective way to rapidly train long-term care team members. This powerful virtual training solution combines leading practices in simulation and game-based learning to improve care outcomes and experiences for residents, families, and teams. Team member performance and observation, safety and risk assessment, personalization of care approach, care interventions, and team communication are enhanced by solving real-world case scenarios in a safe environment with feedback. The purpose of LIPHA is to improve the care and support that your team will provide to vulnerable residents living with varied cognitive abilities due to health conditions such as dementia, stroke, and developmental disabilities. What can LIPHA do for your long-term care home? It can meet various needs, such as onboarding new hires and upskilling recently recruited team members. The benefits of using LIPHA are many. LIPHA's case-based simulation and Ontario CLRI curated resources are all evidence-informed. Your team members will have access to training anywhere and anytime, and it can run on mobile, tablet, or desktop. Key to retaining your team members is LIPHA's deep game design with instant, rich feedback that will reward your team and keep them wanting to return to LIPHA. Your long-term care home will receive unlimited access for PSWs and nurses. LIPHA plays the role of a virtual coach for every team member to help them focus on best practices, safety, and teamwork. And the content is designed using plain language with considerations for learners with English as their second language. In addition, LIPHA can provide reporting to stakeholders at multiple levels, where individual team members can always know their progress in the app, allowing your educator to monitor progress and support individuals and team where needed, and allowing your organization to analyze how your teams are doing. This modernized and digital training approach will significantly reduce duplication of resources by long-term care homes, replacing static content and equipping the workforce prospectively to strengthen the long-term care sector and optimize quality of care and living for Ontario seniors during COVID-19 and beyond. Let's take a look at the immersive learning environment that results in longer engagement and improved knowledge retention and application. Once a member of your team enters a themed learning environment, they will be immersed into a compelling narrative to explore this world while working through simulation and case-based scenarios. The storyline, accompanying visuals, and underlying game mechanics set the foundation for a strong educational game. The core of the game economy are resources, including everything from currencies and badges to quests and power-ups. These can be configured as buyable items with an in-game store to allow learners to use earned currencies to purchase upgrades. Resources can be used to unlock new content or access hints that may be available. For example, in the case of determining the best care path for a resident, a team member can use their currency to purchase various tests to assist with their decisions. Get started with LIPHA today. Improve the relational care and safety within your home and enhance the performance and competency of your long-term care team. LIPHA. Accelerate your orientation and training. Empower your team.
Thank you. So that's Matthew's lovely voice guiding us through that. So you may be asking yourself, okay, what will my staff play such a video game? And it's a fair question. What's really interesting about Canada is the number of people that play games in Canada, in particular video games. And we can see here that more than half to 2/3 of adult women play 8 hours of games a week. And so it's not totally out of the realm, and it's certainly in the realm of the next generation of students that we are looking to recruit into long-term care. And so we see this as a way to profile long-term care as an innovative space that is using the latest technology to support its staff and team members. Yeah, we will be making these videos available for sure. I see that in the chat, so you'll have access to them. All right, next slide, please. A little bit of the rationale. Simply, active learning is far more effective than passive learning. And so when you get to do something, whether it is acting it out through real world simulations, for example, which is what is in LIPHA, you get better retention of knowledge. And so that's kind of what the science is saying. Next slide. The other reason that we use this is we have seen in MRI data that when you play a game, you actually activate the learning reward centers in the brain. So imagine learning being pleasant and not painful. So this is really cool. It also deactivates the tendency to drift mentally. So if you're one of those people who's tired and you're losing focus, when you play in a serious educational game, you're actually required to focus through the game. So it's improved focus. We also put content second and emotion first. So emotion is how we learn and remember things. And so by putting emotion first, we are engaging the learner It's more effective, and it's also a great way to promote empathy. And we do that too through narrative. So there's story involved. We're all storytellers. We like a good story as human beings. And so having a story that kind of wraps around your learning helps you to remember it and structure your knowledge. And we also choose a story that has meaning. So we picked a story about a young Black woman who established one of the greatest empires of the ancient world in Northern Africa. So there's, attention to kind of the cultural diversity and sensitivity pieces, and the idea that there's a meta-narrative that we're doing something in service as healthcare providers. We're bettering our skills in service of humanity. We're not just playing a baseball game online, right? So next slide. Okay, 3 takeaways. Why would you take advantage of LIPHA? We have focused on really developing relational care competencies, getting curious about your residents, personalizing your care. We've also focused on safety. So there's 6 steps that people are taught, and the first one is observation, and the second one is safety and risk assessment. The final step in that process is around teamwork. How would you share back with your team, and how would you collaborate with team, family, and resident to improve care? Those are the 3 key things that we've focused on in LIPHA. Next slide. So what can I say here? This is designed to create a community of learning. We have designed the long-term care home version to be solo play, so you can play alone and work your way through at your own pace, because you're going to be onboarding people at different times and so on. So we knew they needed to get through. There are analytics, and if your home joins us, you have access to those analytics and the performance dashboard at the back to understand how your team is doing and how you can best support them. We also have the capacity to upload your e-learning content. So we can upload SCORM packages so that people don't have to do e-learning twice. And we are integrating with Surge Learning. So any Surge Learning modules that your home wants done and are in LIPHA will be counted in both platforms, so that your team members don't have to repeat themselves. I think that's for me. What's the next slide? So what's in the content here? So our orientation package includes these kind of key areas. It's the welcome to long-term care and introduction to the basics. We focus on activities of daily living and then common care experiences related to top conditions and concerns in long-term care. And there are some nursing specific elements. So this is designed both for PSW and for nursing. And they're playing slightly different cases, some similar content, but obviously playing cases that are relevant to their scope of practice. So there are 2 packages available, one for PSW, one for nursing. They're up to 26 and almost 30 hours respectively, and can be tailored somewhat depending on your needs. Next slide. This fall, we also launched our LTC app. This is a resource app. It's like a digital pocket card. It has resources on IPAC, on dementia, very kind of quick, short things that your staff might need, especially as they're onboarding. And that is also embedded in LIPHA, but also available as a standalone app. Next slide. Great, thank you. I think over to Jenna.
Thanks, Raquel. So we're going to shift gears and jump into our second polling question. And you should receive a prompt on your screen to fill out the poll. So what do you think is the most significant benefit of using LIPHA in your LTC home? So flexible, accessible learning. It offers more immersive learning and improved retention compared to traditional LMS systems. Dashboard for performance analytics for LTC leads to view how their team is performing. Our integration with LMS systems, so Surge, for example, and then if there's any other, feel free to write them in the chat.
We'll just give this poll a few seconds, 30 more seconds for people to get their answers in. And you should see the results on your screen.
Great feedback. Thank you so much, everyone, for your participation. Let's go to the next slide. So one thing that I wanted to note was that the development of LIPHA occurred with ongoing input from our community of stakeholders, so students, LTC educators and operators, and older adults and care partners through CABI's LEAP platform. So we tried to gain their insights, feedback, and recommendations about, for example, relevance and accuracy of the learning scenarios, how to make the platform more engaging, and how to enhance the platform's design. And through this, we ensured that LIPHA wasn't developed in silos, that we engage with our community of stakeholders to co-design LIPHA in an ongoing and meaningful way. Next slide, please.
When you go to a clinical placement as a healthcare student, sometimes you get a really broad experience, and sometimes it can be really narrow or just focused on one thing. So to work with LIPHA and to kind of get to do those case studies where you learn about different clinical experiences, it really complemented actual sort of real life clinical, because you could go through clinical situations that you wouldn't necessarily get to deal with in your clinical placement. I mean, I actually liked the sort of like semi-competitive nature of LIPHA. I liked that sort of we were all doing it at the same time, so we could talk about it and say, like, how did you find this part? How did you work through this section? And then I think my favorite aspect of it was working through the case studies. And I liked being able to like use your points to like sort of purchase or apply for a different perspective. And then at the end, you could sort of work together and get all the different perspectives from the team and from like the sort of make-believe patient. And yeah, I like that. Yeah, I think that LIPHA,
Sorry, everyone, we're having just a little bit of technical difficulty here. Maybe we'll give it one more try to engage. We'll move on to the next slide.
Yes, thank you for that. That was just some student feedback that we had from one of our interns. So as Raquel spoke about, we have been using LIPHA previously. So, and just as a disclaimer, just let you know, there was a recent name change. So that's why Catherine was referring it to Alpha, but right now it is LIPHA. So thank you for all the questions I see in the chat. And even just thinking about the questions that you have now, we have another poll question here is, what do you think is going to be the biggest challenges for your long-term care home to use LIPHA? So maybe limited capacity, lack of staff engagement. Is it specifically related, let's say, to COVID-19? Or maybe you're thinking we already have a long-term care LMS system to use. How can LIPHA assist? Or maybe you're just unsure how LIPHA can actually work within your workflow.
And we'll give the poll 30 more seconds to close. Thank you.
Okay. So it seems like we have unsure how LIPHA might fit into the existing workflow, already have an LMS, and then just in terms of limited capacity. So that's something we're also going to speak about. Lisa's going to talk about how we actually help with the implementation process. So as any innovation, it does take time. We're looking for early adopters. So we will be looking for ways to how do we make sure that it's seamless and compatible with what you have going on right now. And we can just go into the second poll question. The next slide. So the other question that we did have, so in terms of, let's say, reaching out to the homes, because we do feel that this LIPHA platform can really strengthen your training orientations. in terms of knowledge brokers, we really want to know and get your feedback to better understand what is the best approach to actually engage your long-term care homes with LIPHA. So is it cold calling, emailing, or maybe it's making sure that we go through a referral, so a warm introduction? Is it through the newsletter? So OLTCA, KnowledgeBREAK like we have now, or just our newsletters or webinars? Is that something you want more of? Maybe we host webinars every month on LIPHA, so you can just hop in to better understand. So if you can just provide your feedback, please.
Thank you. We'll give it a few more seconds. Thank you.
Okay, so it seems like the majority is really believes that the webinars, informal session, and demos are important. So we really appreciate everyone coming out today, and that's something that we can look forward to, or going down the road is something of having more informal sessions, informational sessions for everyone to attend just to learn more. So I'm just going to pass it on to Lisa. So we're going to actually talk about how we can actually support your homes.
Thank you so much, Matthew. So how are homes going to be supported? So as you've met the three of us already, there are 3 knowledge brokers on the project, and we are here to assist with the rollout of LIPHA in your organization. So long-term care homes will receive access to implementation, education, and technical support. I'm going to talk about each of these 3 supports in a little bit more detail in the coming slides. But the supports do include what we call a LIPHA Champion Circle, or an LCC, resource portal, as well as a troubleshooting portal. And please just note that limited backfill support is available on a first come, first serve basis. So it's free to your homes, and we do offer backfill for the PSW and nurses for the time that they will be spent using using LIPHA. Next slide, please. So the LIPHA Champion Circle, or the LCC, provides ongoing support and engagement for long-term care homes using LIPHA. So the LCC aims to bring together implementation leaders and LIPHA champions from various long-term care homes to regularly meet, exchange ideas on improving LIPHA, and share lessons learned from your staff, from your homes. The LIPHA Champion Circle is also a safe space for LIPHA leads to share concerns and insights with supports from technological, implementation, and educational content experts. So we offer 2 different sessions. So the first one is a one-time kickoff session that we ask the champion to attend, and they can meet with knowledge brokers, education, the educators from CLRI who created the content of LIPHA, as well as folks from Launch 57 who developed the app itself. And then going forward, we can offer and do offer semi-weekly sessions that are held twice a week. So once in the morning, once in the afternoon, and they are on a drop-in basis. So if you think, hey, this week, I'd really like to pop in, just get some ideas, you can come in at any of those sessions. Next slide, please. And then we also have a LIPHA long-term care resource portal. So this is a private website for the LCC champions. Once a champion has been identified from each site, then we will grant them access to this portal. And this website is meant for staff, and it is focused on the champion and their role. So on this website, you will find meeting minutes, the recorded videos from any of the sessions if you maybe were not able to attend, an FAQ section, as well as a knowledge broker corner, which will offer best practice ideas. And again, just to highlight, this is just for the leads. It's not meant for your staff. It's just for the lead at each site to be able to come to, get updated, and just see where everything is progressing. Next slide, please. And then we also offer help with the troubleshooting portal. This is called Spiceworks. And Spiceworks is a way that if anybody who is using the program has any questions or encounters an issue or a bug and requires support, they could submit a ticket using this portal. So a template or an example of this would be if someone, is having trouble logging in, they can't seem to remember their password, then they would just take a screenshot and submit a ticket through Spiceworks. And we have folks on the back end who are able to answer that and troubleshoot it with your staff directly. So it would just include, we just need their emails and what the issue is. Next slide. And sort of, if you're asking yourself, okay, this all sounds really great, what are the next steps? So the first thing you're going to want to do is go on our website, which we will put into the chat, and you can click on the green button that says Get Started here on the left. We will then, and this will then take you to our intake form, which you will see on the right. And at the end of the intake form, once you put in your information about the home you work for, your role, and what you're looking for, whether it's for PSWs, nurses, or both, you can book a 30-minute session with the knowledge broker. And then that way you can meet one-on-one to really learn how LIPHA can best fit your training needs. Next slide. And what is the implementation process? So after you have an introductory meeting with a knowledge broker, you can apply for backfill support if this is needed at your home. We ask that you sign an enterprise license agreement, and then we start the onboarding process. So you will attend a LIPHA Champion Circle kickoff meeting, register team members onto the platform, and then identify a local lead who is going to get familiar with LIPHA and join the weekly LIPHA Champion Circle sessions for ongoing support. And then from then on, it's going to be monitoring the progress via LIPHA's analytical dashboard, and finally improving care through the application of best practices to real-world simulations. Thanks so much. I'm going to turn it over to Jenna.
Thank you. Next slide, please. All right, so before we close off and open the floor to more questions, we wanted to draw your attention to a couple of upcoming events and resources from Ontario CLRI and CABI. So from Ontario CLRI, we wanted to note that registration is now open for our first ever virtual EDI and LTC forum, which will be hosted February 9, 2022. So if you're interested, we invite you to visit our website for more information. From CABI, if you're interested in hearing about other CABI-supported innovative solutions and opportunities to test, adopt, or procure them, you can consider joining our innovation network, and our website is listed for more information, or you're welcome to reach out to myself or Shasmita for more information. Next slide, please. And lastly, we wanted to draw your attention to our upcoming CABI Summit, which is titled Empowered Aging Through Innovation. And it's going to be a great event that will explore the intersection of longevity, health tech, and business, and the ways in which age tech is helping older adults and caregivers make choices that are right for their own aging journeys. And if you're interested, please visit our website, cabi.com/summit for more information. Yeah, let's open the floor to questions. Thank you, everyone.
Thanks, everybody, for that great presentation. That gave us a lot of information, and the chat's been quite lively, looking for some more clarification on things and trying to find out how to expand its use within the homes. So one of the questions that comes up repeatedly is around cost. And I wonder if one of you would just like to speak to the fact that it is free and how that works.
Hi there. So this is Cal speaking. LIPHA is available for free, which is fabulous, don't you think? We also have limited backfill available for team members who are orienting. We can offer you a backfill to actually free people up to do this. So please let us know when you fill in your interest form or your intake form if you would like that backfill in addition to LIPHA being free. We intend to support this after this fiscal year. With COVID, the federal government flowed money down to the provinces, and it came in through the Ministry of Colleges and Universities, and CABI asked us if we would partner with them to promote LIPHA, and so we have, and so that's why it's available for free, but our intention is to maintain it as available for free into next fiscal.
Thanks, Raquel. And we had some earlier questions around which staff this is intended for in the first tranche. And I guess that is for PSW and nursing team members. And what are the plans to expand the program to other groups of employees?
Well, we're open to that. It does require a little bit of funding and planning for us to do that. And it's also about understanding the interest and the priority roles of the sector. And so that's something we will explore going forward into next fiscal, but I don't have an answer for you today.
Thanks, Raquel. Just to loop back on your question about backfill, can you clarify what you mean by backfill? Like the question is it full salary recovery for the full hours spent?
Yeah, so it's a flat rate that the Ontario CLRI program typically offers for training backfills. So I believe it's 25 for PSW per hour and 35 per nurse per hour. And so we would pay, once they completed it, we would pay the 26 hours flat or the 29 hours flat out to the home. Yeah.
Thanks. There's just a question about clarifying the hours again. Is it 26 or 29, or is that dependent on the professional who's taking the course?
So the PSW package is 26 hours. They have just a few less cases than the nurses, and the nurses also have medication administration and nursing assessment pieces. So the nursing one is a little longer at 29.5 hours.
And is there a limit per year for homes for the number of employees who can apply?
No.
That's good to know. And when the PSW does the modules, do they receive any type of certificate after they're completed?
We're working on that. So they certainly get a notification that they're complete, but we want to issue them an Ontario CLRI certificate as a PDF, so that we would like to do that. Yes, we're working on building that out.
Thank you. And because we've had a couple questions in the chat around the topics, I wonder if it's possible to put the topic slide back up while we go through the Q&A, just so people can peruse that. Donnie, if you're able to flip back to that, that would be great. And I love the engagement here. I'm just going to go back and make sure that we're catching all of the questions and comments. We had a question around whether or not the program will support onboarding physicians perhaps in the future. And Matthew wondered if you could take that one, please.
Yeah, so as Raquel was mentioning, so we are exploring different roles. At the moment, we're just focusing on PSWs and nurses. So when we get that uptake and that buy-in, and then also hopefully further down the road, that's when we'll be able to look into other roles to include.
Thanks. Thanks, Matthew. And you also had some conversations going on in the chat around whether this covers off the, whether everything in the ministry guidelines is in the game. Would you be able to speak to that?
Well, this is not mandatory training, just to be clear, but I don't know, Raquel, if you want to clarify.
Right. So we knew that people, that the homes, each home has its own policies and procedures. And so we know you have your own orientation you must do anyways. And so we had to decide what's the value add that we're providing here. So it's not intended to replace your orientation. It's intended to do that which is difficult in an environment where face-to-face training is quite limited. And so instead, we focused mainly on relational care, safety, and teamwork. And so that's really what's embedded. That's the main focus, to give you value add of putting people into this program. That said, there is the introduction. You can see here, you know, we do go over the Bill of Rights and so on, but it's not comprehensive in terms of all the regulations.
Thanks, Raquel. There was also a question around around the demo and what the process would be to be able to see a demo of the program in action.
So I think the best process
Raquel?
is, if you want to just fill out the intake form, and you can meet with one of the knowledge brokers, so we can actually walk through the app itself. So that way you'll be better familiarized with it, because you can walk through the app yourself, but we just want to be your guide when you first enter.
Great, thanks, Matthew. And a number of questions as well around really wanting a copy of the presentation and being able to watch the video. And certainly from OLTCA's perspective, we're happy to put that out in the next issue of the newsletter for everyone to be able to share and watch. Are there other ways that we can get this information to folks? If you have suggestions, please put them in the chat. And I wonder, Raquel, I know you've talked about the backfill, and what other kinds of implementation support are available? You talked about the champion support group, but how do you help folks be able to really get this up and running in their homes?
Well, I think, it's really important to have a keen educator or a keen champion to support your team members. You have somebody, I hope, that you're devoting to sort of integrating new people and welcoming them so that we can retain them properly, right? And so we do want to support that champion, whoever it is, an educator, an administrator, a nurse, or whomever it might be. And so we've done that in a number of ways through the Champion Circle, where they can come in and get tech support. So you have tech questions. There's also, like, you can send an email and get tech support within 48 hours. There is tech support. There's an educator that joins that Champion Circle. So you have questions about the content, or you have comments or areas for improvement. Bring it on. We want to make it better. And then there's a knowledge broker to support you with implementation and sort of working through some of the barriers that might be in your home, some of helping you if you have, anticipated kind of reasons why your staff might say, no, I don't want to do this, and how could you strategize around introducing this in a way that would, help people embrace it. That's what knowledge brokers do. That's part of their skill set. And so they also join those champion circles. We're also happy to meet with you one-on-one to problem solve and to support you as you go on the journey.
Thanks, Raquel. That's great. That's a lot of great wraparound support for the homes. Just wanted to share a comment that came into the hosts and panelists from one of the participants saying, if only a quest-based game like this could one day replace the yearly way we currently do the mandatory education, that would be so much better. This would be a much more fun way for our teams. And so, we can hope for that as this moves forward. And this is the first step. Thank you, Matthew. You put some more information in the chat around the backfill information, which is great. And Raquel, where can people reach out if they have further questions about implementation?
Sorry, one quick question I had was, I just wanted to make sure we addressed it, because I did see a number of questions about surge integration and how to embed it. So I just wanted to make sure we got a chance to speak to it. Raquel, if you could just speak to how surge integration could work for homes that have surge, and how are we supporting homes that don't have surge?
Okay. So if your home doesn't have a surge, but you do have e-learning and you would like to include it as part of the Alpha or the LIPHA experience, so that your team members are getting your specific content for certain things, we can upload your e-learning packages into LIPHA, and you will know whether or not staff have completed those packages. If your home is a home that uses surge learning, then we have partnered with them, and it is a system-to-system integration. So we have already identified and selected certain surge modules that we think are key, and we have already embedded them into LIPHA. And so if your team member goes into LIPHA and completes that surge package, our system notifies the surge system that it's completed. So it will show up on your panel that the employee has completed the surge learning module in question, and LIPHA will also know that they have completed the surge learning module in question, and vice versa. So if they've completed something already in surge, they don't have to redo it necessarily in LIPHA unless they want to. So we wanted to reduce duplication and burden for the learner, but give them the option of repeating things if they wanted to. And so the systems basically talk to each other.
And as a follow-up on that, if the home does not have surge learning, how would it work for the home?
Oh, so that's what I was explaining just before that. So if you don't have a Surge, you're not part of Surge, but you do have e-learning you would like to integrate into LIPHA, you would send us the SCORM package and we would upload it into LIPHA. And so your team member would have a kind of continuous experience. They wouldn't have to like bounce between two systems. However, the two systems don't communicate to each other. All we could do is kind of push out a certificate at the end that says those e-modules were completed. That's currently where we're at technology-wise.
Thanks, Raquel. I'll come to you for the next question as well. If it's another member of the team, please don't hesitate to jump in. It's a question around how often the information in the program is updated to ensure that it's current and applicable.
We just got the first batch off the ground. So obviously the goal is to make sure that it's updated at least every 2 years. But right now we're in there all the time. We're taking feedback. We're learning as we do it. And we want to make it as relevant as possible to the homes. So there will be every plan to keep it current. But right now in this first year, I don't think it's an issue at the moment.
And are there summary sheets for the courses that outline what training components and skills are in the content?
This is something we do not have yet in terms of a summary sheet, but that's something we could consider.
Thanks,
and I see a question about resources available in French. So currently in this round, it is available in English. That said, our vendor, Launch 57, who's been a great partner, basically donated their time and skill, and they have actually created multilingual capacity in LIPHA for us. And so going forward, we can readily put content in different languages, including French. So Jose, that will be a step for the future, not for the pilot, so.
Thanks, Raquel. And once the home has decided to proceed with the program and ready to implement, how soon can it be up and running? How soon can they start?
I'll let the knowledge brokers take that one.
Matthew?
So they can start as soon as they're ready. So the long-term care version is ready to be implemented in the home. So it's really about what works for your team. So we'll meet with you, discuss the schedule, what works best. So we're willing to work around your schedule. So yeah, just fill out the intake form and we'll be ready for your call.
And just a question about the technology. Does it appear on the phone as an app? How does that work?
So it is available via the phone and also desktop version. So you can use it on a tablet, your phone, there's an app, or even on the desktop. So
that's great. And a question, if you can add the intake form again to the chat, we'll make sure that we put that in. And again, we'll make sure that we circulate all of these resources and contact information in the OLTCA newsletter as well to help support intake. Again, a tech question around, is it compatible with the iPhone and iPads? I assume that it is. I believe we saw a tablet in the video. So the actual technology itself is not, it's compatible with all options of tablets that people would have and phones, correct? Great.
Yeah, quite compatible.
Great. That looks like the extent of our questions for today. Some really meaty information here for everyone and lots of requests for the presentation and for the links to the videos to be able to share with their teams. So again, we'll be sure to share this with people on the call today. And I wonder if the presenters have any final comments that you would like to make before we wrap up today's session. Sushmita?
I just wanted to thank the OLTCA as well as everybody who joined in today for your interest in learning about LIPHA. And again, this is just our first introduction. So if you would like to learn anything more about LIPHA, please fill out the intake form. One of our amazing knowledge brokers will connect with you directly, show you a demo, speak to you about how LIPHA might integrate with what you're already doing in terms of Surge, or if you don't have Surge, all of those pieces will be delivered, and really will tailor it to what might work in your organization. So that would be our call to action. If you're interested in, to learn more, please fill out the intake form. And thank you so much for joining and asking these really thoughtful questions. It's fantastic to have your feedback as well. It's been really helpful for us as well. And thank you to my fellow panelists. I'll turn it over to anybody else who'd like to share some lasting thoughts.
Raquel?
Oh, thank you. Just a big thank you. This is really hopefully a step forward for the sector. So please contact us. Our knowledge brokers are quite friendly, and we want to support you as best we can. We're sensitive to the fact that it's a very pressured time for you, and so we really want to make this as easy as possible as we can. Thanks.
Thank you everyone for joining us today at this knowledge break. We look forward to seeing you at the next session. Again, there are 4 more sessions for 2021, and then we'll be rolling out a new series in the new year, and more news on that to come shortly. Have a great day, everyone, and watch for these resources in the next issue of the newsletter. Bye for now.